Hey everybody, welcome back to another edition of Coalitions Getting Coffee during COVID-19. It's been a little while, but we're excited to get another one of these in. And today I have with us Angelica Fuentes, who is the Health Promotions Program Coordinator at Community Healthcore's PREV-NET Coalition. Angelica, how are you doing this morning?
I'm doing great. Hi everyone. Thank you for having me. I'm very excited. It's the first time I do anything like this, so thank you for having me.
Yeah, it's our pleasure. It's our pleasure. I always like to start off with some fun to keep it light. And my favorite question to ask is tell me a controversial but non-political opinion you have, something that you believe strongly about that many other people may not feel quite so strong about.
Ooh, that's a good one. So I feel like I'm gonna get backlash about this, but I strongly believe that pumpkin spice anything is overrated. Like, no, not a thing for me.
Perfect. I love it. I love it. That's a good one. Although I do enjoy some pumpkin spice, I'm kind of there with you. If you were
Okay.
going to try one thing pumpkin spice, would it be a candle or a coffee or something like that? Or you'd just be like, no, if it's got pumpkin, I eat pumpkin pie. I don't know.
I mean, I'll do pumpkin pie, but that's as much pumpkin-y as I'll get.
Okay, good. I hear you. So mine, I was thinking about something different about me. And one thing that I think sets me apart is that I believe when it comes to food, that the original is always the best. So like one of the things in our office right now going around is these apple pie Kit Kat bars that like I am intrigued to try it, but I know it's not going to be as good as the original, right?
Yeah.
Or like when you get like birthday cake Oreos, or even I know this might be controversial, double stuffed Oreos, like nothing is as good as the original. I don't know why they did white chocolate Reese's. That's like just a waste to me. So when it comes to, especially, I guess those are all like candy and cookie options. The original is pretty much always the best. The only exception would be like sometimes with movies, maybe you could make an argument that like in Star Wars Episode 5 is better than Episode 4 or something like that. But in general, the original is always the best.
Yeah, I'm right there with you on
All
that
right,
one.
good. Glad we have that in common.
Yeah.
So it's my understanding, Angelica, that PREV-NET is a new coalition. Tell me a little bit about it and the role you play there.
So PREV-NET stands for Prevention Network for Northeast Texas. So we are a new coalition. We are a regional coalition across 9 counties, which are, I have my little sticky note here. Um, Cass, Bowie, Marion, Harrison, Gregg. There's 5. I need 4 more. You're quizzing me here. Red River, Russ, Panola. I believe that's 9. So we are regional. So we're trying to connect all the work that is going on across these 9 counties and talking to each other so that we're stronger together and make a prevention network more sustainable for our youth. So we do work with youth ages 9 to 20. And again, we are new, we're just getting started. I am the coordinator, so I, pretty much do the back end work of everything, but also make the calls, if you will, for now. So we are trying to build more partnerships. So, getting on the phone and talking with people who are already doing work with the community, reaching out and telling them a little bit more about what we do. So again, we are a prevention network. So we are focused on prevention. We don't provide any services directly, but our main role right now is building the coalition and building those partnerships so that we can provide some type of prevention, whether that's, a sticker shock campaign or an evidence-based program for our students that, focuses on social emotional learning skills that can help them not only with increasing their protective factors, but also decreasing those risk factors as well. So all of those things are things that we're looking into and doing, but again, we need the help of our community. We want to join the efforts that are already existing now so that we can help make them stronger.
Awesome. Yeah, that's a big task. And if you are curious and you're watching about the coverage area, I've looked at a map of y'all's coverage area, and it's just like the rim of like Northeast Texas, all the way down, getting like down the Louisiana border, and then all the way up on the Oklahoma border. So
Correct.
it's a pretty cool, it's a pretty big area that you guys are seeking to cover. And so I'm excited to see kind of the work that you guys get done as you get going. Wanted to ask you, Angelica, so we do youth substance abuse prevention. Where does your passion for that come from?
So I did get my master's in public health. So public health is all about prevention and looking at issues across a systemic lens, if you will. So based on that, with my background, I strongly believe that we can provide students and youth the tools they need from the beginning to ensure that they have a good future and ensure that they feel safe where they live and they can achieve their best potential. So based on that, growing up, I had a great system in my family. And I believe that they served as a protective factor for me and for all I've accomplished, so far. And if students had that system that they know is there for them to listen to them, that serves them, I believe that we would have more of our kids in East Texas thriving. So being able to focus on prevention and ensure that they're not relying on substance use ties back to the whole life course experience for our youth so that they can reach their highest potential.
Wow, great answer there. Appreciate that. And it definitely, I can hear the passion in your voice. That's good. And you guys are going to do some awesome things.
Thank you.
So this interview is part of a series called Coalitions Getting Coffee During COVID-19. You may have heard of it. It's been around for quite some time. So I remember it like the first initial shutdown happening sometime in March, if my memory serves correctly. And so we are like 6 going on 7 months since the shutdown. So I'm just curious, how has the coronavirus impacted you guys in your work?
Well, so I started with community healthcore in June. So back in March, I was finishing grad school online, if that tells you everything.
Gotcha.
I did take, so right off the bat, with community healthcore and PREV-NET, I've been able to apply everything that I've learned in school. So I try to look at it from that lens, that I am literally applying everything I've learned in prevention and public health right now, especially with all the school closures or uncertainty with schools. Our students and youth are going through a difficult time right now. So now more than ever, they need to feel that support from those in the community. They need to feel like they are heard, that they are seen. So it's a perfect opportunity for something like PREV-NET to come along, ensure that all the resources are seen and known across communities, so that we can serve our youth. Sometimes, there's resources out there, but families don't know about them. So rather than waiting on them to come to us, we are trying to go to them and meet them where they're at right now. So even though we've had a couple barriers, reaching out to schools, they're overwhelmed right now with everything going on. So we want to be that help and that hand that reaches out to them. So it's been challenging, but again, I feel like it's a great opportunity to have something like PREV-NET, and for people to know about it.
Yep, that's great. Yeah, we know that now that we're several months into this, there's been some studies done about how the coronavirus has impacted youth, and I think the number was 39% have said that they've experienced some kind of negative emotional fallout because of the shutdowns and the lack of school and whatever. I'm sure there's a million different reasons. And like you, we're also trying to reach out to the schools, and we definitely have had, there's just limitations. The schools, as they should, are taking the precautions needed to make sure that the virus doesn't spread. But that means that guests like us can have some trouble getting in and giving presentations, or just getting a hold of teachers as they're working overtime, working
Right.
both on campus and via Zoom and all their online working. So it's definitely been tricky for sure. But I want to kind of take that question and then kind of twist it and see if we can find the silver lining. So we know that, I mean, it's kind of obvious the downsides to the pandemic, but I'm just wondering, like, someday this is going to be over. And I'm just wondering, like, do you see any silver lining in this? Is there something that's happened since COVID-19 where you're like, yeah, this is bad, but when it's all said and done, I think we'll come out stronger because of X? What do you think?
Yeah, definitely. I feel like, for instance, this conversation alone goes something along the lines for what I'm about to say. The community that comes with all the people and stakeholders and organizations that want to serve the community, us coming together to target the same issue or the systemic issues, if you will. Because again, sometimes, organizations don't talk to each other. And now with everything going on, us taking a unified approach to, trying to get into schools or talking to, a principal, a teacher, hosting events that are, along the safety guidelines for COVID, can be carried out later in life once COVID is gone and when things are quote unquote normal again, if you will. So having these conversations with stakeholders, building those relationships, for instance, PREV-NET and you guys as well, and then everyone else who's listening to us, us coming together so that we can better serve the community, I feel like it's something that will go beyond the COVID-19 time.
Awesome. Gotcha. So what are you most looking forward to when it's all over?
Well, I want to spend time with my family and travel with them without that fear of, my parents are older, so am I exposing them? Is it too risky for them? So I want to be able to, take them on a nice trip now that I have a job, and be able to, just relax, spend some time without feeling that uncertainty of if we're being exposed.
Yeah, I hear you. So yeah, the way I'd answered that question in the past was there's several things. One of the things that's annoying, but I think people have kind of understood it now, is the sneezing in public, because I tend to have some allergies, and I'm not sick and I've got a mask on, but when I sneeze, I feel like I don't know if I'm getting evil looks, but sometimes I wonder if I am. So I try to make it very obvious that I'm turning away, even though I have a mask on. So that's one of the things. And another was sports, but some of the sports are kind of picking back up. So I think they're figuring out how to pull it off, even though it's
Yes.
not quite the same. But
I'm a soccer fan. So yesterday I saw my first live soccer game and it was so exciting. I've been watching YouTube videos and highlights so this whole time. So it was nice to finally see a live game go on. So yeah, I feel you on that one for sure.
yeah, cool. Well, I've got one more fun question for you, but before we go there, I just want to give you a chance to tell everyone who's watching how to reach out to you in case they're interested. Maybe they live in one of those counties that you mentioned in your coverage area. Maybe they have a passion for substance abuse. Maybe they work for a school, or maybe they're a health professional, something like that. And they're like, I'd like to get involved in some of the work that you're doing to make your coverage area, East Texas, safer when it comes to substance abuse. How could they reach you?
Yeah. So we do have an email. So it's PREVNET, PREV-NET at communityhealthcore.com. So I'll share that with you in case someone needs it. And then you can reach us at 903-234-9200. And again, the counties that we cover are Red River, Bowie, Cass, Marion, Harrison, Panola, Rusk, Gregg, and Upshur. So if you have any questions, feel free to reach out. Again, my name's Angelica, so I can, talk more about this with you.
Yeah. And so if you're watching and you're in that area or you know someone who is, that could be a great addition to their coalition team. They're still in the early stages trying to build up their membership. And so a big part of that is just getting people around a table to get the conversation started about what they're seeing and what they can do to make a difference. So if you know people, make sure and encourage them to reach out. I'll have the description or in the text below the video or whatever. I'll be sure and share the information. So if they want to email you or call you, they can get a hold of you.
Thank you.
Yeah, you're welcome. Fun question now. What is in the mug? If you have a mug, what's your go-to morning drink?
Okay, so very controversial. I do not drink coffee. I am not a coffee person. I don't think I will ever be a coffee person. I tried in college, but yeah, it didn't work out. So I drink water. I have the water here. So I do usually in the morning drink, hot water. I'll put a little bit of honey or lemon in it. So, if I do have a mug, it'll probably have hot water in it. And then throughout the day, I know I chug my water. I used to be really bad about drinking water. So now I think I'm like on that other end of like, yeah, you need to calm down with the water now. So I've transitioned. I do have a couple of fun mugs from my childhood that I treasure very deeply, but I don't carry those around for fear of that they'll break.
Oh, I gotcha. Cool. Yeah, so we need to edit this video now because your first controversial opinion is not nearly as controversial as this one, that you don't drink coffee in the morning. You drink hot water with lemon and honey. You got to be kidding me. No.
Yeah.
You're a healthy one. That's great. And drinking, it's kind of hard to drink too much water. So you should be proud of yourself for that. I am a coffee person. I definitely like coffee. I've got my own little coffee mug here, even though I'm working from home. And yeah. I drink this. This is Brady's Coffee. It's a place in Tyler where you can get they have a bunch of different kinds of beans that you can pick from. This one is Jamaican Blue. So I'm not enough coffee connoisseur to know exactly like the flavor palettes of each one, but I'm kind of interested in trying different kinds, and it's really, really good. So that's what I'm going to this morning.
Yeah. Well, you're a step ahead of me because I would have no idea.
Yeah. Well, that's okay. That's okay. You can tell me everything there is to know about water. All right, Angelica, thank you so much for your time. I hope you guys experience some growth, and I really look forward to seeing how your coalition takes off. Anything else you want to share?
Yeah. Thank you so much for having me. Again, we are open to speak with anyone who's interested in helping out our youth. We're here to help and we're here to serve, and we want to hear from you. So give us a call, shoot us an email, and let's get this conversation started.
All right. Thanks, Angelica.
Thank you.